Okay, then the next paper of Jane it's back to you again.
Yeah, sorry, it's me again.
But I hope also with Victor on strengthening patient and public participation in NHS England.
Do you want Victor to start? Or?
Between the two of you.
Well, I'm happy to give an overview. My view is that we've made good progress on designing some policy guidance for NHS England, which, in my view, go beyond the minimum required in Section 13Q of the Health and Social Care Bill. There is some good practice in engaging the public. I'm pleased to see that we haven't abandoned NHS Citizens completely. Version 2 is being rolled out, or being looked at anyway. The task force that you asked me to chair, Malcolm, is coming to the end of its first phase, and I'm hoping that one of the products of that first phase will be a dashboard which will allow NHS England as a board to get line of sight of what's happening out there and how it contributes to our core business commissioning. We are consulting on the next phase of the task force. There's still work to do, in my view, in corralling and understanding the role of the voluntary community sector in the delivery of health and social care, actually, in the business. I think there's a lot of work to do there. There is a notion which I've tried to dismiss, really, that public patient engagement is somehow the same as comms and public relations, and it isn't. This is something which we need to embed in the way we do business as usual, and we're still away from doing that. I am hopeful that what will come out of tomorrow's announcement will assist in that regard, but that's all I've got to say on the report. I'm sure Jane might want to add some detail.
Apologies.
That's all right. Crack on.
Okay, so I just thank you, Victor. So building on that, the paper just gives you what we promised to do. So back in 2015, you approved the last policy. We said we would come back with an update on progress and a revised version, and that's what this does. We have deliberately attempted to go, or are going much further than the minimum statutory 13Q requirements. And there are a multitude of ways in which you can truly engage with patients and the public. And the important thing for us is to make sure that we do that in a meaningful way and actually listen to people in the system and base it locally, rather than necessarily trying to do it as a top-down from NHS England. And we have some great support from people in enabling us to do that. And I have to say, including from a gentleman that's sitting in our audience today. We have got in here an update on our 10-point plan, which does show that we've made some significant progress. A lot of that has been around training, particularly both of our staff, but also patient and public voice partners, which is really important. We've also established the involvement hub that actually gives people an opportunity to access some of that information. And as a good example, the paper highlights that within the first 3 months, we had something like 30,000 views of that. So really, really having an impact. One of the things we've tried to do is embed patient and public voice into our priority programmes. So as an example, we have produced specific guidance around our different commissioning areas, so that the teams that are looking after, for example, health and justice, specialised commissioning, have dedicated and specific support to do the patient and public voice engagement in those areas, which has been good. And we set up an advice and support service so that people could access expert advice if they needed it. And we get about 30 requests a month for that, which is helpful, so people can provide that level of support. We are in the process, as I think Victor mentioned briefly, of developing a dashboard so we can try and find some sensible ways of updating and providing some more information for the board on what we're doing and how we're doing it. So making sure it's meaningful, not tick box, that it's actually linked to what our priority areas are, but also not forgetting that some of those, so other people will have a valuable and important role to play in actually giving us feedback. And then the revised policy, which is attached for your approval. We said that we would come back by the end of March 2017 with a review of that policy. We've invited partner organisations to give us their views. We've had about 106 different responses. the sorts of messages we had were, please can you connect it better? Can you reduce it in length? Can you make it more simple? And so what we've done is we've responded to that. We've turned 2 documents into one. We've made it more straightforward, and we've tried to make it more relevant to our particular commissioning arrangements. It feels like it's in an easier place. It's much better. It's a simpler read than the previous 2 were. So I think we now need to focus on how we implement and support the STPs, and we're looking at ways of doing that at the moment with the central team providing direct support to STPs so that the PPV engagement in STPs is the best it possibly can be, and that's a really important priority for the programme moving forwards, and I think we've got the mechanisms and the expertise in place to be able to do that now. So I'm very happy to take any questions, Malcolm.
Joanne?
Thank you very much. This is obviously a really important area, so I had a couple of questions. One was the 106 responses to the new policy. I mean, in the context of the 800 patient and public voice partners, did that feel like a good number of responses? So that was one thing I was interested in. And the second thing was about thinking about what's our investment and resource in this area. So as we think about helping STPs with their consultation requirements, how much do we spend on patient-public involvement here? How many? Can we get a sense of how many, for example, how many people we have whose primary job is around this in our own organisation? Whose primary job is this?
I can't give it off the top of my head. I'd have to go back to my team and check. But we've got 2 different. We've got the patient public involvement division of my directorate, and I've also got a patient experience team.
Right.
So within the PPV team, there are people dedicated to this part of work. Mm-hmm. We've also got people that look at insight and surveys, who also help things like focus groups and report on things like friends and family tests, national surveys. We've also got a patient-centred care team that do quite a bit of work on that, and we have access out to different voluntary groups and voluntary organisations that come together to provide us with support. So overall, there is quite a lot of support. The other thing, as well as the 106 responses, we also held quite a few meetings, training sessions, focus groups. So the individuals involved in those haven't been listed separately, but they also contributed to the feedback.
But in terms of quantifying the resource, that would take a bit of,
it'd be relatively straightforward to do. I just can't give it to you off the top of my head.
No,
It's probably also worth noting that we do work in a strong partnership with Health Watch.
Exactly.
So there is a it's not as though we're the only game in this town. But your question is a good one.
Well, thank you. At this stage, we're parting company with our Chief Executive and National Medical Director for...
Temporarily, not
temporarily. No.
Storming out at this point.
Well, parting company has certain connotations.
Anyway, all the best to the team.